Hi, welcome to this Facebook Live. Director for Alliance for a Better Utah. And today on our round table, at a rectangular table, is Voices for Utah's Children, Lincoln Naring, right? Did I say that right?
You did.
Perfect, okay. And Utah Decides Healthcare, Riley Curtis. Welcome. So today we're going to talk about the Medicaid Expansion Ballot Initiative, which officially got enough signatures. Congratulations. What was that like getting all those signatures?
Okay.
Yeah.
Give me the mic. She's looking at me.
He's hogging the mic already. 30 seconds in. I don't have a lot on.
So we had to collect over 113,000 signatures across the state of Utah, and we had to meet those thresholds in 26 out of 29 Senate districts. We started the latest out of all the ballot initiatives, so it was a sprint to the finish line for sure. We used every day that we had, but we, in the end, turned over 200,000 signatures.
That's amazing. Well done. Well, I think you guys probably started ahead of Keep My Voice, right?
But technically speaking,
does that
yes.
count?
No, not really.
Okay. All right, cool. So now Alliance for a Better who has a personal experience with the need for medical marijuana. So not the same thing, but a similar, it's one of the ballot initiatives. So his wife was diagnosed with very aggressive cancer. They've gone through a lot of financial situations because of this, because of her diagnosis. So look for that tomorrow. But back to you guys over here. Lincoln, can you tell us a little bit about Voices for Utah Children?
Voices, we are a 30-year-plus old child advocacy organization. Making sure that policymakers give our kids and our families what they need to succeed. And that's why we're here and supporting the Medicaid Expansion Ballot Initiative, because it is
great. Now, can I ask you also, why are you involved in Voices for Utah Children? What got you into this work?
Look, it all comes down to people, and Voices for Utah Children, we advocate for Utah families. That is just so central to making society work, is making sure that we have strong families. Kids can access high-quality pre-K, making sure kids have healthcare coverage, that their families are strong and economically secure. So for a guy that cares for Utah families, which is amazing.
Great. And then Riley, on our own Facebook Live, but talk to us about why you have been involved, why you decided to work with Utah Decides Healthcare.
So I have to. I'm born and raised in Utah, and I've lived folks who fell into this Medicaid coverage gap, and I was coming out of college right when the ACA passed, and so I was interviewing folks who were living this life day to day without access to healthcare coverage, with chronic medical conditions, and seeing the impact that policies can have on these individuals. So for me, it's about making sure that I do what I think is best for my community and really help these folks gain access to affordable healthcare.
Activity, everybody's favorite activity. So this is a game that we play on our Facebook Live, a Better Utah broadcast, and we've called it "Is This Real Life?" And that is, of course, an ode to the young boy David Goes to the Dentist, the YouTube video where he, probably 8 to 10-year-old kid, had oral surgery and he was still on the pain meds when he was in the car and having an existential crisis, and asked his dad, "Is this real life?" Which, of course, we've all had that moment. So this is in honor of the whole fake news, whatever. We're going to play a game where I'm going to read to you guys a news headline, and you have to tell me if it's real or made up. Okay. So some of these are real, some are fake. Okay. So the first one, and my advice is just to pick one and just go with it. First one, Florida City apologizes for alert warning of zombies.
Real life.
Real?
Yeah.
Hold on, you have to say it into the mic.
Real life.
So we have it on the record. All right, Riley?
I'm going to say not real.
Okay, that's real. He's like, zombies, it had to have happened.
Yes.
All right. Teacher fired for throwing Game of Thrones themed classroom party.
Real life?
Yeah, that has to be real too.
It's fake. I mean, it may have happened, but Kyle's so excited. He wrote that one. All right, next one. Nebraska man calls 911 because he needed a ride to work.
Real life.
Real life?
No, it's fake. I know these are hard, right?
See,
all right.
Healthcare like gurus.
Yeah.
What comes to mind there is we need to protect transportation and Medicaid,
Right.
so people can actually get to the healthcare that they need.
That's true. That's true.
Yeah.
That is a good tie-in. Well done. All right. This one has no healthcare tie-in. Sorry, I can't say this word. Lynxes have heated debate at side of Ontario Road.
Like the cats.
Yes. I've never tried
Real
to say
life.
that plural.
I feel like the last three were not real, so this one has to be real.
Yeah.
Yes, it's real. And it's hysterical. You should go watch the video. All right, next one. Two more. Ohio man calls 911 to report being stalked by a pig.
This has to be real too. There can't be two false 911 stories.
Ooh, I like your logic. Yeah, that's good.
I'm jumping on the Lincoln bandwagon.
It is
life.
real, and it's hysterical. Yes. It was like 5:30 a.m., and the cops were like, oh, okay, this guy's clearly inebriated, and there was, in fact, a pig following him home. Yes.
All right.
It was a domestic pig. It had escaped its home. All right, last one. Squirrels fill car's engine compartment with pine cones.
Well, I feel like that happens to my own car regularly, so I can't believe it's newsworthy, but sure, it's real.
So I agree that it probably happens, but I think it's an Onion headline. It's from the Onion.
It's real.
Oh my god!
And the picture, it's like completely full.
Oh, no.
It's completely full. All right. That's enough of that. Let's get back to the real business. All right. So let's talk about the ballot initiative. What does it do? Who supports this ballot initiative? And then let's break it down and talk about the legislation that just passed this past session versus the initiative. So, Riley, can you tell us what this initiative does?
Yeah, so we call this a traditional, in my words, straight up Medicaid expansion. This is if you think of an individual, they would have to make less than about $17,000 annually. And for a family of four, they would have to earn about under $32,000 annually. Do you want to say anything about the family part of that? Or?
Well, I think you
Yeah.
have to. To talk about parents and families is parents are in a unique situation in that the state of Utah covers really low income parents, but we don't cover working parents between 60% and 100% of poverty. Yep. Normally, I think we think about Medicaid expansion as, well, Utah just doesn't cover adults. But in Utah, it's true. We actually do cover really low-income adults. It's just those working families that we have decided that they don't need coverage thus far. So that's why the ballot initiative is just so exciting and so important for families, is it eliminates that coverage gap and really does everything that we want. It encourages families to work and
yeah, it's pretty. I mean, I think that's important because we currently have a system that has perverse incentives built in for families. So, for example, a family of four, two-parent household could earn under $1,000 a month, and they qualify for Medicaid. And then, as soon as their income goes above that, they're kicked off. They're penalized for working harder. And so, I think that's a really important point. Is that situations in their lives for their families.
But we can now talk about, I guess, how it compares to the legislation. And I mean, what the great thing about the ballot initiative is Utah has a history of not necessarily effective. And for the last, really since the passage of the ACA, we've been really cute around Medicaid, and it's resulted in us doing nothing and not expanding Medicaid. The ballot initiative is not cute. We're not asking for permission. We're not trying to tinker with the program in ways that just doesn't make sense and leads to the result that we've seen in the last several years, which is no expansion. We are just going to do it under the ACA, as the ACA envisioned, and thousands of Utahns, including thousands of Utah parents, are going to gain coverage as a result. Mm-hmm. It's straightforward, it's simple, it makes sense. It's what we should have done from the beginning. But now we have the opportunity to do it this fall.
Yeah, it's about 150,000 Utahns that'll gain access to Medicaid coverage through this initiative. And I believe 1/3 of those are currently parents with children in the home. And then that's not to say that the remainder might become parents in the future. And we all know that, making sure people are healthy before they have kids is really important too.
And then Utah also has, in addition to one of the higher uninsured rates for adults, we have one of the highest uninsured rates for children. And the majority of those uninsured kids, or not the majority, but a significant percent of those uninsured kids in Utah are currently eligible for Medicaid. But for whatever reason, they don't sign up. But what we've experienced in other states, when we begin to offer families coverage, when we begin to offer parents coverage, they're more likely to sign up their kids. Yep. And that uninsured rate for children in those states, it drops significantly. So this is not just about extending coverage to parents. It's also about extending coverage to children. We're covering the entire family, and that just has great impacts in terms of economic security, improved health outcomes. It just makes strong Utah families when we're able to cover not just parents, but their children as well.
So, Riley, when you guys were out knocking doors and, approaching people, walking out of the stores or whatever it is that you guys were doing, we went out to a food truck Thursday out here, and we tried to get people to sign, and people loved the medical marijuana one, of course, and the Medicaid expansion. And what were people saying when they were signing? My experience was when I was asking people to sign various ballot initiatives, a lot of people were like, oh yeah, I'm totally all over that. And then as they were signing, they would start talking about the issue. What kind of responses were you guys getting from people who are signing?
So there were, impacted them, having lack of access to healthcare coverage for either themselves or someone in their family. One of the last days, it was the Sunday before the Monday that the signatures were due. I was in a Walmart parking lot, hounding people as they were coming in and out of Walmart. But this lady, I asked her, will you sign this? This is to expand Medicaid to 150,000 low-income Utahns. And she told me about her husband who had served in the military and for one reason or another was not getting TRICARE, which is the military's medical insurance. And he had had a stroke and she was not able to get him health insurance. And so she is just spending her days how this impacted. And right after I talked to her, I talked to another guy in that same parking lot that same day, and his daughter was on Medicaid. And I asked him, how is Medicaid treating your daughter? He said she wouldn't be alive without it. And so I want every Utah well, this is to expand Medicaid. Well, this is going to cost me money. And so we talk about that, but we would walk and has been for 5 years. For incarceration costs, how mental inefficient ways, and so this really streamlines the process. And I'd say 9 out of 10 people I'd ask would sign my petition.
Wow. My family, we're very lucky that we have insurance through my husband's work. And I have 2 young children, 3 years old and 1.5. And I wrote a blog post about this, actually. This past flu season was horrendous. I mean, I don't like primary children's was overflowing with kids who were sick with this flu. It was just awful. And both my kids caught it, and my older one was okay, but my younger one caught it, and we thought he was fine. And then he slept for hours and hours and hours one day, and he started breathing really light, and I just started panicking. So I took him to the urgent care, and they said, no, his oxygen levels are so low, you have to take him to primary children's. And he was prioritized at primary children's. Like, he got, like, he was 1.5 years old. Like, it's heartbreaking to see your kid wearing an oxygen, right? And the thought was going through my head the whole time, like, I am lucky I did not have to hesitate for 1 second, because I know I had healthcare to take him into the emergency room, right? But what happens for a family who doesn't have this coverage? How much time do they spend? Like, how much time matters? 5 minutes going, can I afford this? Can I spend thousands of dollars on this bill? And I mean, we're still paying for it. There's still money that we owe for it. But, those seconds and those minutes matter, when it comes down to it, when your kid's health is at risk. And so I think it's wonderful what you guys are doing in terms of that. It's so essential.
Of course, that's a number I didn't come armed with. But if you go to our website, www.utahchildren.org, we have a number of fact sheets. But it's tens of thousands of uninsured children. So there are about 80,000 uninsured kids in Utah, and a high percentage of those are Medicaid or CHIP eligible, but not enrolled. Utah has one of the lowest, if not the lowest, uptake rate in terms of the percent of eligible children that we get in the program in the country. And one of the reasons is that we don't provide coverage to all parents. And making this step, expanding coverage to all low-income adults, including low-income parents, working parents, is going to help Utah kids catch up to their counterparts across the country.
And is that what the coverage cliff is?
Yeah. And the coverage cliff is real. I mean, one of the stories that I share is actually from my hairdresser. I get my hair cut, every month, and I go and I see my hairdresser. But one of the things that she tells me is she has to be really cautious about how many clients and how many hours she works in a month, because she has some significant health issues that require specialty care. And if she works too many hours, even though she's healthy and capable of doing that, because she's getting the health care that she needs right now, she'll lose her Medicaid coverage, and she'll lose access to that care that is enabling her to work. And that's just a horrible situation to be put into, because that her inability to work as many hours as she's capable doesn't just impact her. It impacts her ability, she's a single mom, to be able to pay for the things that her kid needs, that her daughter needs. Her daughter's starting high school, making sure that she is clothed and well fed and has the things her daughter needs to succeed in high school, is impacted by her inability to work as many hours as she needs, because she would lose her health care coverage if she takes on.
We pride ourselves on our hard work, but we're penalizing these people who are right there on the edge. That seems pretty
right. And odd.
I
mean, Riley, about one of her stories of the story she gets when she was getting people to sign the ballot. One of the stories that I often hear is it's common sense that Medicaid expansion just makes sense. I mean, there's a list of reasons that it makes sense, bringing back federal dollars, but also just making sure that our families that Utahns have access to the care that they need, they have the coverage that they need, and there's this program available that's affordable to the state that allows us to do that. Why don't we just do it? And
just do it.
Well, hopefully we will. Come November, what does the, you don't have to give too much away, but what does the campaign look like from here to November? What can we average Utahns who are not necessarily heavily involved in politics or campaigns, what can we do to kind of help in the persuasion campaign?
Yeah, I mean, so we obviously have a public conversation that we have to have between now and November. It's going to get louder and more robust the closer it gets to election. If anybody is watching this who falls into the Medicaid coverage gap, or knows somebody in their family that does, or a friend or a hairdresser that falls into the coverage gap, I mean, connecting them with the campaign will be critical, because this really comes down to Utahns. And that's what people respond to, is knowing that this impacts their family members, that it impacts their neighbors. But we will be, out at public events. So come say hi to us. I mean, we'll be, doing TV and radio. So all of those great things that you see in a campaign, a well-run campaign, we'll be doing those. And we look forward to the vote in November. And I'll say one more thing on this. We have been running, I feel like we have been running this campaign for 5 years. And that's not a joke, like, at all. That is very serious. And, we will continue to be out there running this. And we have had several polls that have been done in the 5 years leading up to now. And we've always held strong at 60% or more support for this. And I think that shows, no matter what happens at the legislature, no matter what opposition comes out there, Utahns know it's a good deal for the state.
So I expect we're going to see a lot of misinformation in the coming months. You're going to hear stories about how Utah doesn't need the ballot initiative, that we've already have a Utah solution out there. And I think it's imperative for all of us to make sure that people understand that we don't have a solution, that what the legislature did this past session has not provided health care coverage to a single individual yet. And it is highly unlikely, in my opinion, that it ever will. That the ballot initiative is necessary to make sure that low-income Utahns and our low-income families have the coverage that they need. That Utah has not solved this, and we need the ballot initiative to make this happen. Yeah,
it sounds like the solutions that keep kind of coming up are all talk and no action type, like, look, on paper we've done it, but in reality it looks like it's not covering anybody or very few people. And so now I want to close with kind of an obvious question, but for people who are watching who have maybe not experienced the issue of not having been covered before, why does Medicaid expansion matter? And it's not just like because we cover kids. Like, what is the real life impact of having health insurance for these thousands of people and these thousands of children who do not have it? And then what does a fully covered community look like? Does it impact the economy? Does it impact children in school? What does this look like if we do this well?
So the easiest way for me to kind of answer your first question is through another story. And when I talk about why I'm passionate about this, Carol Frisbee actually comes to mind. She's in a documentary that Alliance for Better Utah and Utah Health Policy Project helped medical students do a couple years back. And, she had PCN. It only allows you access to a primary care doctor, and anything they can't provide there, you can't get access to. And so she was in extreme pain and needed to get testing done, and it turns out a colonoscopy, and it turns out because she didn't have Medicaid, she had
a wrong way to look at things. We need to understand that kids are not just free radical beings floating out there.
Some of them are.
But they're attached to parents. They're attached to families, and the health and the well-being and the security of their parents. That is going to play a huge role on the success and on the livelihood of children. So if we want successful, healthy kids, we also need to have healthy, successful parents.
That's so true. And I guarantee that if a lot of uninsured parents, they're going to put off going to the hospital until it's probably too late, or the problem is so much worse just because of the financial impact, and how it impacts your family. All right. So on that happy note, we're going to close up for today. Thank you guys for joining us. How can we get in contact with you guys? If people are watching and they want to get involved with your organizations, where do we find you?
So the Medicaid Ballot Initiative campaign can be found at www.utah.decides.org. Utah is spelled out. And we're also on Facebook and Twitter as well.
At Utah Decides?
Yes.
Perfect.
UtahChildren.org.
Perfect.
Thank you.
All right. And with that, we will see you guys next quarter. Thanks.